Today we're here with Dr. Nadya Wayment, family practice at Tanner Clinic of East Layton, and we're talking about fall prevention in our seniors 65 and older. So I'm really excited to have Dr. Wayment help educate us about the importance of falls and getting falls in a timely manner so our sweet elderly patients don't end up in the hospital with an unnecessary fracture. So Dr. Wayment, as a physician, what do you see typically as the main cause of a fall in our senior population?
Well, I think that many falls are unfortunately often multifactorial. So some of it is certainly age-related. Many of the falls are problem of cognition, elderly being by themselves, having any kind of metabolic issues and conditions like diabetes or neurologic conditions that cause peripheral neuropathy together with diabetes. Many of them have had strokes or heart attacks that have caused congestive heart failure. So it could be basically just about any chronic condition and any condition that changes sensitivity of people, of their feet, or ability to basically even perceptually understand where they are. So vision problems, hearing issues, any chronic pain where people can't really think clearly when they're even making their path, the conditions, how they live, and the environment in which they live, because not everyone apparently in their homes also will have clear passages. So it's actually a very complicated question. A lot of it also depends on polypharmacy, unfortunately, and many of them being on multiple different medications, and sometimes out of the best intentions, people seeing many specialists, if the medications are not carefully weighed and put together, that can also cause the fall. So many of them will be at risk of falls, and statistics actually works against our patients at 65 years of age and older. So many of them will be at risk. I believe around 27% I've seen in literature recently of people over 65 years of age will be at risk of fall. And many of them, whoever had the fall in a specific year, will be always at risk of consequences of the fall or additional falls after.
And I think that some of the highlights of the consequences you and I were talking about, and so what do you typically see when you have a patient that's had a fall or multiple falls? What are the consequences of those falls, and typically what happens as a result?
Well, unfortunately, many of patients get injured. So it could be minor injury or major injury. Many of them get taken to the hospital. Some have surgeries depending on the injury itself. Unfortunately, very many of them never recover from the initial injury and surgeries, and many of them don't get back to their previous functional status, which is a very concerning issue. It increases the chances of them being admitted to nursing homes and being basically long-term facilities. We know that our population of people, elderly people, is a very independent population. They want to stay at home. They want to stay being independent. They don't want to be a burden on their kids, even though I don't believe they would. But many certainly are very concerned about this. And so for them, they're very devastated. In fact, I've even ran across one of the articles in which people were saying that, according to the questioned adults, many of them were saying that they would rather be dead than be hospitalized or sent to the nursing home afterwards and after the fall and injury. And this is a very scary statistics. Many of them will have to be in pain for a long time because of the injuries. Many will have the impairment or immobility in which they will need some additional help at home, be it home health, be it additional caregivers, caretakers, having somebody to take them from that point on to doctor's visits and to different physical therapy or rehabilitation in any way. So falls are actually a very significant issue for many of our adults.
Yeah. And I think that one of the things, is that from a doctor's point of view, you guys can't be in the home. You see your patient when you see them. So a lot of times, what are the preventative measures that we can take in helping patients to age in place, helping patients to, have as much independence as they can. And sometimes I think it's a matter of getting home health and private duty involved that,
Absolutely.
will help a family out.
Absolutely. Those resources with home health agencies in the community are absolutely priceless. So, for me as a primary care physician, I realize the limitation of the fact that I see most of my patients in the office. So, this is really being a spot check with the patient, and so I unfortunately don't have the eyes behind the scene that can tell me how their household looks like. Are there other people involved, are they safe? Do they have a good nutrition? How clean is their house? How clean the passages are and stuff. So often for me, when they bring somebody from their home, a caretaker or a son or daughter or granddaughter, so basically these are my eyes, for them. Often I really do appreciate when people agree to home health services, and that's why I think they're of huge benefit for patients, because they have huge resources, and many people don't even realize about them, because when the home health gets patient admitted, so especially fall or any kind of hospitalization, so they come in, it's not just the nurse that comes in and assesses the medications, the consequences of how the person got on their service. It's also a physical therapist, it's an occupational therapist, it's the CNA certified nursing assistant who comes in and helps them with their daily routines, which is a huge deal. That's the part I would never see as a physician, in fact, and it's a huge drawback. Then we also have the ability of a social worker that is a huge benefit to come in and talk to the family, talk to the patient. Social workers have been of a huge benefit, like for me personally as a physician, from home health agencies, because usually we don't have other abilities for social workers to ever come to see the patient anywhere. So with home health, they do come in, and that's a huge, huge opportunity for people to actually get their services. Sometimes for family members, this is the ability to talk to them about nursing homes or assisted livings if the elderly adults are ready to move on to the next stage and they do feel they're not quite up to speed to take care of themselves. This brings a lot of peace and a kind of ability of reconciliation, to family members, because then they don't feel the guilt. They have the resources of where to go. They can go and assess the places if that's what needs to be done for their parents' safety. They also do this home safety evaluation that, like, many don't realize that they do. So the way we see it, the social workers going in, working together with physical therapists and occupational therapists, they look for railings at home, furniture that can be of danger, making sure the passages are clean, making sure that everything is on the same floor. If there are stairs, then they see if railings are safe, if they are steady. Bathrooms, showers, these are most frequent places where unfortunately people fall, and we have no means of knowing about this. Again, I don't see them at home. And that's a huge drawback for me as a physician. So having somebody else's eyes, like home health, I often rely upon them just to make sure that patients are safe.
And I think that's great. And, a lot of people often are a little resistant because they're afraid how much is this going to cost me? I can't go anywhere. And, I think the beauty of home health is that, Medicare and most insurances will cover it at 100%.
It's just huge. Yeah. I think it's a huge benefit. I agree with you. Because these are conversations that I usually have with patients. So anyone who had a fall or who has been recently hospitalized, anyone over 65, somebody after surgeries, they don't even have to be 65. When we discuss with them the options, I always offer home health just because I would love for them to have these benefits, these services, the support from elsewhere, where they can feel safe and get the services to them while they're healing still. So these are the concerns people always voice, because they're concerned. Elderly often don't live on a fixed income. So for them, knowing that this is a covered benefit is huge. I always appreciate home health agencies who can come in and actually take the time, just like yourself, to come to patients and to their family and explain all of these little details, little and big details, because many just don't know about this in a community. I think that not just the price is the concern. Many of them are afraid that they're going to be disturbed time-wise, place-wise. There is also the big restriction that many impose on the patient state, and you have to be homebound. And people are like, well, I'm not homebound. So many people confuse the concepts of homebound and bedbound. Those are two different concepts completely, because I explain to patients all the time that if it is a taxing effort for them to come see me in the office, which means they need to have a caretaker, they need to have somebody push their wheelchair, they have to have somebody drive them because of visual hearing impairment and stuff, or they just had a foot fracture, hip replacement, where they can drive themselves, well, that technically puts them in a homebound position. Not bedbound, but homebound.
Right.
Whereas homebound, they still can go to the grocery stores. They obviously have to eat, they have to cook, they have to be able to participate in their cares. They can go to church, they have to take care of themselves physically, emotionally, spiritually, in any possible way. That is not being taken away from them by no means to get the home health services. But these are all scare factors that people are very concerned. And I explain all the time that I've actually never seen an agency or worked with who has been like very disturbing to patients and intrusive into their lifestyle.
Right.
Usually schedules have been picked based on patients' preferences. I think that most home health agencies that I've worked with have been very understanding, very patient with patients, very caring, and trying to make sure that everything is up to their liking. I, in fact, think that the fear also comes from not knowing who's going to come, because they're so conservative in their nature, having things set a specific way. Well, my gosh, the older I become, I'm more conservative, I think. So every day, this just happens to us as adults, I think. And so when people usually have somebody come in, they're not sure if this is an okay thing or not. Most home health agencies, in my experience, have the same team come on board. And I think this brings huge comfort to patient and the family too, because they know exactly that it's not a change of caretakers consistently, that they have the same nurse, the same physical therapist, same CNA come in, and that helps big time.
Right.
So a lot of explanation, a lot of education with patients, and I think that people really truly do benefit from these services big time.
Yeah. And I think one of the most important things too is that, we're not in there every day taking care of them. And so it's not, because I have had patients actually say, I don't want people in here every day.
Exactly.
And so it's, we develop a care plan, we have goals on that care plan. And the goal is to come in and work with you and get you back on your feet again. And so it's
to keep them independent. That's exactly what they want and what they really need. So it's interesting you're saying that they don't want them every day. I personally, as a physician, I would love for somebody to be there with patient every day, especially after the fall or after condition of hospitalization and stuff. But unfortunately, these are the limitations of services we can't use. Neither home health or hospice will come in. But the purpose of home care is always to make people back independent, give them their independence, their functionality. And I think once my patients hear this, many of them are much less reluctant to use home health services, and they've been benefiting for years and years. In fact, we don't even have to be that drastic and wait until the next hospitalization and stuff. We don't have to wait for the bad things to happen. So if on the physical exam, if during the get up and go test, during the Medicare physical, or in any other way, I see that the balance is not up to speed, if the person is weaker on the strengths exam, if their cognition is not there on the mini mental status exam, I always bring up the possibility of home health and doing it at least preventatively, because I feel that if they don't fight for this, for the balance, for the strengths, for ability to know how to make it out of one room to another, for the night lights, that's yet another part where many elderly fall at night, so all of this education takes place somewhere between myself and the home health agency. I think somewhere all of this gets covered all together, and it's certainly a complex approach, but it does work for many. And if it takes us, even with all the education, to prevent 1 or 2 or 5 patients from falling per year, that's fantastic.
Great. Well, thank you, Dr. Wayment. I think that this has been really great, and hopefully will help educate our community, and more importantly, help those of you that have aging parents to identify some of the things that Dr. Wayment's talked about today, and talk to your provider. And again, this is a preventative measure to help our seniors age in place, but also prevent a nasty fall.
Thank you so much. And thank you, Kelly, for everything you guys are doing, because being with Home Health Agency, you certainly have helped a ton of my patients, and you've done a great job. And the staff and the physicians who are working for you are certainly very attentive to patients. Patients are very grateful for the services. And I think I really can say that to just about every agency I've ever worked with, because you're my eyes and ears. And so thank you for that.
You're welcome.
Thanks for having me.
It's an honor to work with you.
Thank you so much.